Okay, so what I want to talk about today is a very good AC joint exercise that we use pretty much day one after the initial injury. So from working in rugby league and rugby union, we pick up these AC joints on a Friday, Saturday, Sunday, and then the very next day when we see them, they come in, they're sore, very limited range, don't like across the chest, etc. I find this exercise very, very good, and we can turn these injuries, if they're grade one, to even grade two, we can turn these around very, very quickly, okay? And some of them will get back within that week, okay, within that 7 days. So this exercise, I think, is very, very valuable that we start them straight away. Now, all fours, we can do a lot of variations of this, but for the AC specifically, our knowledge of the axis rotation and the knowledge of stressing particular tissues, like we cover a lot in the mentorship, we can get the all fours to put pressure, okay, good stresses on that AC straight away in order to build tension, transmit forces well through the shoulder. So what I'll do with an athlete is I'll get them on all fours, and all we'll do is we get them to rock over as far as they're comfortable and then back again. Now what I want to do here is I want to make sure that the athlete isn't putting too much pressure on the left hand if it's a right shoulder injury. So what's very often they won't want to load it, but the key here is to build tension through the hand, through the elbow, up into the shoulder, okay? So we're teaching the nervous system to use this full limb again as soon as possible, okay? Building tension through the floor, but most importantly, we're giving them confidence to use the shoulder from day one, okay? And if we can stop that protective postures, okay, and then worrying about the shoulder, give them that confidence, the mindset can change very quickly, and that then very often is the difference between getting them back for that following week's game or them dragging on and taking 3, 4, 5, 6 weeks. Okay, so what we want to do is as we come through, we're loading that tissue here via the hand. So we're pushing a lot of pressure through the hand, okay, and we go into a lot of specifics of hand pressures in the mentorship, but just for now we're going to load through the hand and then we're going to explode. Okay, so we're getting that pressure and then exploding again. Now the nice thing about this, it doesn't look like much of an exercise, but what we're actually doing here is we're putting them into the positions that ultimately are going to be the last usually to settle. So this kind of across the hand with an AC, usually they don't like that. But from day one, we're starting to lengthen and load those tissues again. So they're getting the confidence, and we're recruiting more units, okay, as part of a team, a chain, transmitting forces. So we're looking at the contractile components of the muscles, but we're also treating the brain with the nervous system. So we're getting the two of them together by building tension through the hand, loading the posterior capsule, posterior cuff, forcing the clavicular fibers of pec major to recruit, okay, which will be very, very important as well to allow us to get that last little bit of internal rotation as the hand comes across the chest. Okay, it's a great exercise from day one. As I said, I'll get them to do that a few times a day. We'll get them to do other variations depending on their needs. And then as the week goes on, we can just progress it. So we can easily get them up into press-up positions and repeating the same kind of movements. So knowing the reactions throughout the body, allowing ourselves to build tension through the hand is taking care of the contractile units, okay? But also from a nervous system point of view and treating the person, it gives them a lot of confidence. So then when they come across here, their nervous system is being there pretty much straight away. They're not protecting that kind of range of movement. Okay, so it's a great one to do. As I said, build tension through the hand, feel it actually loading the tissues here, okay, ideally pain free, and you'll see as that athlete gets a little bit more confidence, all of a sudden they'll be over here very, very quickly, which is pretty much in that provocative position, but it's a different stimulus for the nervous system, so we can almost trick the brain, okay, into decreasing that nociceptive signaling, so that then when they do go across, we don't get that pain response. Okay, so give it a try. Get good at doing it yourself before you get good at coaching it and kind of troubleshooting any issues that they have.